Are you suffering with pain in the back of the knee? Well, I want to tell you about a small muscle that you might be missing out, which could be the key to getting rid of your knee pain. And that muscle is the popliteus muscle. So let's dive in and talk all about that muscle. If you're new to our channel, my name's John. I'm the head therapist at John W Sports Injury. At this channel, we want to be doing 3 simple things to help you. We want to help you understand your body so you can get rid of any pain or weakness and ultimately strive forward to hit your health and well-being goals. But today we're talking about knees, and in particular, a particular muscle that lives in the back of the knee, and it's often overlooked. The reason it's overlooked is it's quite a small muscle. But the key thing here is it has an important part to play. So we can, by all means, get back of the knee pain for multiple reasons. Things like our hamstring muscles that come and attach onto the back of the knee, our calf muscles that come up the back of the leg and attach across the back of the knee. But we also have this small muscle called the popliteus, or hear it called different things, perhaps depending on your accent or where you learned, but I learned it's the popliteus muscle. Now this muscle runs from the outside top bone, the femur bone, and it comes down and attaches onto the inside of the lower leg bone, or the tibia. Now, what's happening here, what this muscle does actually, is that it has an element to play in rotation of the leg, and that's an important factor for reasons that I'm going to discuss. So we know that the knee is a hinge joint and that it moves, relatively speaking, forwards and backwards, but we also have this small amount of rotation that happens at the knee, and that's when the popliteus muscle really starts to kick in. So if you're noticing that you get your pain perhaps when you're doing activities that cause you to twist or turn, or you get a pain on twisting and turning at the back of the knee, then it is likely, or it's potentially, that it could be this popliteus muscle. So how can you start to find that out? How can we start to investigate this muscle? Well, what we can do is we can start to palpate the muscle. So as we start to feel into the back of the knee, you can start to actually feel this muscle. So this space at the back here that we call our popliteal fossa, our body space, if you work into there and you feel some pain as you push through and you can feel that muscle in there and that recreates that pain, that's one indicator that we could be getting some pain in this popliteal muscle. Well, what can you do about that? Well, first of all, we can look to stretch that muscle. It can become short and tight that's causing our pain. How do we stretch it? Well, we know that it flexes the knee and causes some internal rotation at the knee. So when we stretch a muscle, we want to do the opposite thing. We want to look to extend the knee and we want to externally rotate the knee. So in order to do that, it's worth using something like a block, or you can see here I'm using a foam roller to wedge your toe up upon. And then if you have that leg very straight, and by leaning forwards, you'll also be able to get more extension out of that knee. But remember, the key thing to hit that popliteal muscle is to externally rotate. So you'll notice in the stretch that the toe is being turned outwards in order to really feel that stretch. And that's how we can start to make it different from stretching some of the bigger muscles like the hamstring and calf muscles. Another thing that you can look to do is actually look to get some self-massage work into there. So by using your own hands and finding that, you can look to work into that tissue and loosen it out. And if you find a sore point, we can do some pin and stretching techniques or some release work. So if you can find that muscle in the back of the knee, right in the back there, and then you feel a sore point, if you look to just straighten that knee, I can actually feel my popliteal muscle now being lengthened, being stretched. So by working through there, that can really look to release that area and create a relaxation of that muscle. And when we combine these two things, that is a good way of starting to reduce the sensitivity of that popliteal muscle, and then you can start to load that knee again with some of these activities where you're looking to incorporate rotation slowly. But if you do suspect that you've got some popliteal issues, I would strongly recommend getting that checked out by a medical practitioner, reaching out for some more detailed advice so they can give you the appropriate program. Because remember, back of the knee pain can be caused by multiple things and multiple structures. But what I wanted to do in this video was just highlight that key muscle that could be the absolute necessity in unlocking the back of your knee pain. Has that been helpful for you? And have you made it this far in the video? If you have, why not do me a favor and hit that like button so you can help others with their popliteal muscle, and make sure you subscribe. Hit the subscribe, hit the bell notification, all of that good stuff, and then I will be letting you know as soon as we drop our next video. And I look forward to seeing you there.